All right, today we're going to be performing some trach care. So first thing we'll do, come to the patient's room. We've gathered all our stuff. Come to the patient's room. We'll do our safety check, make sure everything looks good. In the environment, we will introduce ourselves, do our patient identifiers, explain the procedure, and get consent. And then we're going to check our equipment here. So I'm going to get some gloves on for this. So first we'll make sure our oxygen is running. So as the doctor ordered, so our oxygen's here. It's 4 liters, our orders are 4 liters, so that's good. Then we're going to check our suction equipment. So we'll make sure all of this is connected, everything looks good. And then we're going to check our suction. We want this to be between 80 and 120. Okay, that looks good. We'll put return the clean glove on it. Just leave it up here for when we're ready. Okay, so to prepare for this, we're gonna need to pre-oxygenate our patient. So for that, we're gonna turn our oxygen up to 100% and get him to take 3 deep breaths. 2, there's 3 deep breaths. 3, okay, so that's good. We'll return our oxygen and we can take off our mask. Okay, I'm gonna get some clean gloves. I'm going to do hand hygiene. Okay. Okay. The first things we're going to do is we're going to suction our patient. So we look at our size here, got 8 on there. So to do the math for that, you minus 2, so that'd be 6 times 2 is 12. So we're going to need a 12 French catheter. So we've got our catheter here, and we'll grab our suction, like that, and we're going to open our package, and we're going to attach suction, and we're going to pull this out. So we want to keep this sterile as possible. Okay, so we're going to make sure we've got this covered. We're not going to suction on the way in, so we'll just keeping this sterile, trying not to touch anything. Get this in, and then we're going to twist, turn for 10 to 15 seconds, no longer. There we go. Now we'll dispose of this. Have it go in the garbage, and then we can get a glove. Place our suction, and we'll stick this out of the way. Okay. Get rid of this glove. And we're going to perform hand hygiene. Also, I should have mentioned before, we would always make sure our emergency equipment is at bedside too. Okay, so now we're going to change the cannula and we're going to change the dressing. So we'll open up our sterile field. Okay, we'll get rid of, we've got a garbage bag. I'll just ask to use his bed. Trying not to go below my waist too, I would have just dropped that. Get our things out. We've got our more gauze, lots of gauze. We'll get our forceps and our scissors out of the way. Go to the side. Now we'll open up what we're gonna need. We'll put so we've got a drain sponge. I'll open up. And I probably have enough 4x4, so I won't need any more. Drop that in. We'll dispose of the garbage. And then we've also got some Q-tips we're gonna need for cleaning. So, okay. Here we'd have to get a new pair of forceps, but for the video, I'll pretend I didn't drop those. Okay, garbage. We'll open up our thing. And again, we'd be monitoring him with the SpO2 monitor. And if, say, his O2 stats did drop, we could just put the mask back on and reoxygenate him. To proceed with this, we'll take some saline water. We'll make sure that it is not expired, and this is a new one, so we don't have to lip it. Put some in there. And we've also got our new cannula, which we will open and prepare. Set this onto the side. We'll do hand hygiene. Then we'll get some fresh gloves. One, two, and we're going to go ahead and take this cannula out, so we'll stabilize, pull it out, there we go, dispose of that. We'll also take our old dressing off. There, we'll dispose of that. And we'll get new gloves. And hygiene. Fresh pair of gloves. We're going to replace the cannula now. So we'll open this up. We'll do no touch technique. We're going to go kind of in on the side and twist. There we go. And now we're going to clean our, I didn't touch anything, so these are still clean. Now we're going to go ahead and clean our stoma. So, grab our forceps, push some of these Q-tips to the outside, and grab a Q-tip, dip it in our saline water, and go underneath, just a U shape, dispose, saline water. Now the top, go. Get him to lift his chin a little, swipe. There we go. And we'll do the bottom again. Just go. Stabilize, swipe, throw it out. Saline, one swipe in a U shape. And good. Now we're going to do the same thing with some 4x4 gauze. Saline soak it. We're gonna go underneath. There. Dispose. I would make sure. Remembering to stay sterile in everything you do. Stabilize. Get him to lift his chin. Swipe in a U, dispose, and then we'll dry it too. So we'll get some dry gauze and stabilize, swipe the bottom, dispose. And we'll grab another 4x4 to do the top. Stabilize. And we're gonna swipe, and then we'll dispose. Okay, next we're going to replace the drain sponge. So for this, we're going to grab one of our sponges. In my sterile field, fold it down, pinch, pinch. Okay, and we're going to just try and tuck this up. as much as we can. Now we want to keep around the stoma sterile. So we're going to kind of tuck it underneath. There we go. There. And now it's safe to use our hands for the outside of the drain sponge, because that's not going to be touching the stoma, and we just need around there to be sterile. So fold it up in there, and now I might just use my reach, poke a little more under there. There we go. There. Okay. There we go. Making sure not to touch anything in there. So everything's dry. We've got this. And now we're going to return the oxygen. So we'll make sure we're running at the correct rate. Some hand hygiene. Make sure everything's running at the correct rate. Some fresh gloves on. So we're at 4 liters. That's what's ordered. We'll get him, just lean your head forward. We'll attach our oxygen, and we are going to, so yeah, we'll do our safety check at the end. Okay, we've got our oxygen running correctly. We know our suction is working. We'll put our bed rails up, call bell, and reach. We'll make sure, we'll ask how it was tolerated, or note how it's tolerated when we document. And clean up, and we're good.